Hi, Colin. How are you today?
Very good, Dr. Fong. How are
Great,
you?
great. Thank you for letting us do this testimonial about your Invisalign treatment. And we always like to hear different people's comments, and especially ones that turn out very well. And your results turn out great. And I just want to hear what you have to say about it.
Sure.
I think your treatment went about 20 months, right? You were saying?
Yeah, I initially started off about 2 years ago, and I had a hard time sticking to the regimen, particularly the 20 out of 24-hour period every day to keep the aligners in your mouth. And after 4 months, I thought, enough of this. I'm wasting my time and money, and I really got it together about 1 and 3/4 years ago. So a little less than 2 years, and I'm happy with the results.
That's great.
Yeah.
And it happens. I mean, I wear Invisalign. I know what it's like. Sometimes you leave it out. You think you're going to leave it out for 1 hour,
Yeah.
and it turns out to be 5 or 6.
Yeah.
And then if you forget it at your workplace, it's even worse.
Yeah, it's hard. It's hard to
Yeah.
maintain it. It's easy to maintain it at home because you've got your sink, you've got all your bathroom products. You're
Yeah.
usually not too busy there, but at work, I would have to add additional routines like alarm on my computer to tell me to put the device back into my mouth. So when you're at work
Nice.
or you're away from home, I'd have a toothbrush, toothpaste in my glove compartment in my car. I'd have to set my watch timer, so it's a little more difficult when you're not at home. But like I said, I'm pretty pleased with the results, and the hard work pays off.
Great. No, that's good. I'm really glad to speak to you about this because a lot of times, our results don't get the achievement that we want, and we always, we're scratching our head, and the patients sometimes don't tell us the whole story,
Right.
what's happening, and so we just have to assume that that's the best we can do. But sometimes we can do better once we have a good talk with the patients as to what's going on. So I'm really glad that you've given us this particular insight. And at the end of the video, we're going to show you before and after pictures,
Sure.
and it's great. And I'm really pleased. And your case is one of the difficult ones. We actually took a tooth out for you, right?
That's right.
Right in lower. And if you look at your smile, you can't even tell there was a tooth missing.
No, you can't.
Yeah, and there was some reluctancy when I suggest we take the tooth out, or you didn't mind.
Well, you're used to your teeth. I've had it my whole life.
Yeah.
So you're removing something that I got used to for 40-something years. So.
Yeah. And there's no
I was
looking back.
a little reluctant, but it's on the bottom, and the end result show it didn't really matter anyway.
Yeah.
Anything beyond one tooth, I would have been
Yeah.
concerned.
Yeah, and it's true, and that's the good thing about Invisalign.
Yeah.
I'm confident when it comes to taking out teeth because Invisalign, with their prescribed treatment, you can actually see what the results are going to be like, so that we're confident that taking that particular tooth out is not going to be detrimental or affect the aesthetics of it.
Yeah.
And so, whereas when we do braces and we take a tooth out, sometimes it's not what we expect. Whereas Invisalign, with the prescribed treatment, we can really know what the final results are like. So, but it's great. I'm really happy to.
Yeah, I think in hindsight, I think I did a pretty good job.
You did.
Getting to where I got.
Yeah. And you
But in hindsight, like I said, that 20-hour rule is tough, and I think all I could tell people using it, stick to the rules, and you're going to get to where you need to go a lot quicker, and then it's done. That's it. So.
One last thing,
Yeah.
you're a very entertaining patient.
Oh.
We enjoy having you here.
Well, I'm afraid of your 1-inch punch, so I have to behave myself when I'm here.
That's
so,
right.
Yeah.
But you've been very entertaining, and as I said, I've seen the progress in you, with the treatment and everything, and but we really do enjoy having you coming
Thank you.
here,
Yeah.
and and enjoy this time that you have
Yeah.
spending with us on this particular interview.
Yeah,
So,
everybody seems happy here, good
Yeah.
spirits, and it's
Great.
always a pleasure.
good.
All right,
Appreciate it.
All right.